A recent report linked to Johns Hopkins University in the United States and Sweden's Lund University described the benefits of COVID lockdowns as a drop in the bucket compared to the collateral damage that they caused. Johns Hopkins has since distanced itself from the findings, saying that the evidence was not properly peer-reviewed. But not before it reopened the debate. Was the cost of COVID lockdowns a price worth paying? Welcome to Roundtable. I'm Philip Hampshire. The World Health Organization calculates that nearly 7 million people died as a result of the global COVID pandemic. What is harder to calculate is to what extent lockdowns prevented that number from being much higher, or whether the economic fallout from locking down entire nations had an equally disastrous effect. Even Johns Hopkins University, a globally renowned institution, appears nervous about its conclusions. So let's discuss this with our guests. Joining me today in the studio, we have Professor Steve Keen, who's an economist. We have James Hartfield, who's a writer for Spiked magazine and a historian. And joining us live via Skype, we have Michelle Khan, who is a social epidemiologist and a professor of global public health at the London School of Hygiene and Tropical Medicine. Michelle, let me start with you. Now, this study came out. Johns Hopkins has already distanced itself from the results of this study. They've done it on the grounds that the study has not yet been peer-reviewed, but the study's also coming under flack because it was conducted by economists rather than people who are involved in virology or epidemiology or various other disciplines in an appropriate field. You are an epidemiologist, so what was your takeaway from this report?
Yeah, so I mean, I guess I do work really closely with economists, and they have a lot of value to add. So I don't think that's an issue in itself. I think that science is stronger when it's done with a multidisciplinary team, and naturally there is the risk of what we call groupthink. So I do see that as a weakness. The other point about the study, it has made some really large claims around lockdowns being a policy failure, and then naturally things aren't as black and white often, so I can see why there's some concerns and some distancing taking place. My impression is that, well, one point was that the term lockdown that's been used and the wide range of policies that have been grouped together under what's considered lockdown is quite wide to really draw firm conclusions. So they've defined it as any non-pharmaceutical intervention that's mandatory, and that could include then presumably anything from masks to school closures to stay at home. So that, I think, is something that's worth unpicking a little bit.
If you deep dive into the report, you'll find a lot of variation in their data as to whether or not countries did well or whether they did poorly. Do you think that's because so many different ways of reacting to the pandemic were tried, and they've sort of tried to average the numbers because they are looking at metadata, they are looking at top-down numbers?
Yes, and it's apart from how different countries implemented lockdowns, there's also things about how their social systems are, social security, so that also impacts the extent to which voluntary measures are adopted. That was one of the points that was made, and I can understand that having the option of non-mandatory but voluntary social distancing, for example, could work as well, but it depends on the society and the extent to which people are able to do that, and for example, the extent to which there's inequalities that prevent people from being able to socially distance. So, yeah, lumping country or dividing countries just on the basis of lockdown, yes or no, does lose some of the other nuance that distinguishes how countries and their societies are functioning.
James, cultural factors should have been taken into account when countries were considering how to respond to the pandemic. What do you think?
Well, that's true, and also age spread in the population and income, all these things make country comparisons very difficult. But I think the main takeaway is certainly worth looking at, and we'll be looking at this for a long time to come. But I think that the evidence is mounting that a lot of the non-pharmaceutical interventions had social costs that we didn't take into account seriously, because our focus was obviously on the disease, and which in some cases may be as bad as the damage to the disease. You can see like the dislocation in Sri Lanka and South Africa today, what's happening in the economies of Europe and North America. We paid significant costs for this policy.
I'm reminded a little bit of duck and cover in the sort of 1950s, where school children in the United States, as a response to a threat from a nuclear warhead arriving in the US, were told to duck and then cover themselves with a blanket or something like that. And there was a great deal of debate in the 60s and 70s as to whether this was a completely useless technique. At the very best, you could say it had marginal benefit. But there was also the psychological benefit from the fact that people felt like they could do something. They felt like they could be empowered. So even if a mask, we could debate whether masks worked or whether they didn't, but even if they didn't work, was there a benefit in your mind to people undertaking these simple things?
I think you can be clear about what does and doesn't work, but what you're saying is right in that I don't believe that the politicians imposed a bad solution upon us. I think the demand was very much from the bottom up. And this was, in some ways, was the problem, is that many of our decisions were made in a state of heightened fear, which didn't always lead to the most rational outcomes. And I strongly suspect that if we were faced with a similar epidemic in the next 2 years, we would moderate some of the proposals, some of the policies.
Steve, now let me bring this across to you, because if we're talking about rational policies, there are a lot of people at home who would look at, you're wearing a mask, your mask has a tube filter that leads all the way up to it, that leads down to an electronic HEPA filter. This is not your own invention, is it? So tell us a little bit about it.
Okay, well, this is a HEPA filter. Everybody's used to having air conditioning back at home, and you buy the best ones have HEPA filters, which filter out 99.9% of all particles below, between 2.5 micron and smaller. And so that's what this is doing. So that's just holding the air around my face, which is why I'm happy to take it off in the studio. But this is pumping 99.9% filtered air at my nostrils. And that means that there's 1,000 particles inside this room. I'd pick up, if there's 1,000 particles near me, I might pick up one. Somebody with this was 50, and somebody who's wearing one of those blue masks everybody was forced to wear at the surgical is picking up 300. So
you're not an alarmist conspiracy theorist. You have a method to your madness as to why you picked this choice. What did you think of other people then with their choices as mask mandates came through and they were forced to wear paper masks?
The bad choices are made by politicians in the very first instance. And like I can't give you rank and serial number on this, but the health minister for the UK in about 2015 to 17 ran an exercise on pandemic prevention, and she asked the experts how many masks should we have in stock, and their answer was about 1 billion. Now, she took a typical Tory attitude, oh, that's going to cost too much money, let's just put aside 50 million. How long do those masks last? 1 day. Now, this is where bad planning, not being aware this is going to happen, and if we go back to the 1990s, the then New York Times health reporter, Laurie Garrett, did a brilliant book called The Coming Plague. And just looking at all the data, PhD quality research, said there's going to be another plague like the Spanish flu, probably a variation.
One crops up every 60 to 100 years on average.
Yeah, that's right. So we know it's going to come. We should have planned for it. And if we'd planned for it, we would have knocked it off in 6 weeks. And instead, we did all this terrible stuff, which a bunch of economists playing statistics, as that's what economists tend to do, can then say, oh, it wasn't good, it wasn't bad. It was disastrous right from the outset.
Well, let's have a look at what the economists actually said, because not every viewer at home will be intimately familiar with the nature of this report. This was a working paper that consisted of a review of 34 studies and a meta-analysis that included 24 of them. In addition to concluding that the lockdowns produced limited results on COVID-19 related deaths, they went on to find that shelter-in-place orders reduced mortality from COVID-19 by 2.9%. However, in their conclusion, they also say that closing non-essential businesses seems to have had some effect, reducing COVID-19 mortality by 10.6%. But that's 10.6% from levels that were maybe 3-4% of total deaths in most West European and North American countries. So, in what ways do you think that some of the responses were over the top, as this study seems to indicate?
Well, only over the top because economists don't understand health and they should keep their noses out of it, frankly. I'm working on climate change right now, and economists have intervened inside there. They've trespassed, literally. They know nothing about the area. They're boys playing with statistics, which is what this meta-study is about, so I'm highly critical of the work of economists in general. What they've found, of course, if you do something badly, you'll get bad statistics. Well, that's remarkable. And like I moved from Amsterdam to Thailand at the very beginning of the crisis. This is in March of 2020, because I could see what was happening in the UK. The Netherlands was actually worse, falling for this nonsense about herd immunity. Thailand was doing masks. It actually manufactures them. We outsourced all the manufacturing to third world countries decades ago, so we couldn't make masks. We had to buy them. They weren't selling. Moved to Thailand. Within 6 weeks of us arriving, there was no COVID. And that was the case from June until December of 2020, when then there was a imported case and then another one in March, and they lost control at that point. But from seeing it at a practical point of view rather than statistical, if we'd followed what the epidemiologists and the experts on pandemic control had said, we would have eliminated this virus in something like 12 weeks. And I mean, it would no longer have existed.
That's absurd.
Well,
you disagree with that?
I'm quoting Janir Baryam, not myself. Okay, I'm not an expert, but I'm going from somebody who is an expert and controlled Ebola in 2014. We could have eliminated this virus. We didn't do it.
It's a respiratory virus. They spread all the time. You can't contain them. I mean, it's just, I think...
Steve is against herd immunity and is against the idea of keeping shops open. I assume you're against the idea of keeping high streets open, which was the Swedish model.
Janir's idea, and you can find this on a website called endcoronavirus.org, which he established when the virus began. He said two weeks of a complete lockdown except for essential services, which is food, sewerage, water.
Did we not try that?
Surreal.
China tried it, and China knocked it off.
This literally makes no sense at all. I mean, you might as well be speaking Chinese, because you're not making any rational point here. There's just nothing in it.
The rational point is that we now know how it's transmitted. It's transmitted by air. It could have been by touch, as it was for Ebola.
We're a social species.
We
interact with each other, and that's what germs and diseases are.
And that basically means we concede and we know we're going to lose and have an endemic virus which is causing brain damage.
Well,
I think it's an extremely bad approach to public health.
Michelle, let me take this across to you. What's the current feeling? Yeah. Obviously, within the epidemiological community, you have to sit down and you have to look at it and go, well, look, we tried maybe 20 different ways of dealing with this thing in various different countries around the world. At some point, you have to break out some numbers and sort of look at it and go, what works, what doesn't work? What can you see as having worked?
So I think we knew up front some of the strategies that we were just slow. So testing, right? We don't talk about it, but having enough tests, testing early. If you can identify who's infected, then you can have them quarantined, and it doesn't have to be a population level stay at home or lockdown, right? So I think this is something where the capacities and the scaling up of testing in many countries just wasn't sufficient. So I think that's something where we could have done better, and there was a lot discussed at the time. I think some of the earlier points made about it's easy to say in hindsight, but even if we think about, say, school closures, it was really, really difficult decision. There's been huge impacts on education, and it impacted parents, etc., as well. But when there was so much uncertainty about how dangerous the virus is in the initial period to children, there was also, like I said, bottom-up demand for children to be protected. So it's quite tricky now to say what should have been done, but the tried and tested things around scaling up testing is something that I do think should have been done, and we did know in advance. And also we knew in advance about the social and equity impacts. So I would point out that I don't think we should let politicians off the hook now by saying that, oh, the science is only, or the studies are only now showing that there were these huge impacts in terms of, say, education, mental health, etc. This is something that was entirely predictable and should have been taken into account when the policies were being planned.
James, I think that's got to be part of the call for this. For most normal people who are looking at this, yes, obviously you get some benefits of some policies, but you also have to rack up the costs of those policies, and the costs of locking a lot of people in their homes were very, very high. Do you think that the benefits met the costs or not?
You know, this was such a hard conversation to have.
And we're having it in retrospect as well, so we have to be fair to the people at the time that they couldn't see the information we have.
Yeah, if you just take, like, health, so the NHS saw 1/5 fewer people over the period because we had advised people not to go to hospitals. I was working at Guy's Hospital as a vaccinator. I'm still working at Guy's Hospital. And at that time, it was empty. It was empty because nobody was being treated apart from the very ill and the people with COVID. We were vaccinating people. We had intensive care for people with COVID. But all of the other 1 million things the NHS does every day weren't happening, or a significant proportion of them weren't happening. Right now, we're struggling because there's a massive waiting list. The waiting list accumulated during the pandemic because of the way we shut down our NHS provision. And that is killing people. You know,
This is people who have cancer or perhaps were a little bit worried about their heart, and then they put it off for 18 months because they're locked down or they're discouraged from going to the hospital, and the condition gets worse because that's just the nature of conditions.
The impact, and, you know, I don't know where you write this up. You could say this is COVID or this is consequence of the policy. So it's not an either or, but it has had dramatic impacts, and that's just in health. And we have this very peculiar situation today where what you would have expected, the outcome of the passing of the pandemic would have been a reduction in deaths. But what we see now is there is also excess deaths since the pandemic. People are still trying to understand this, but we did anticipate it. In SAGE, they wrote the reports to say it would have impacts on heart, on all kinds of other diseases, dementia. All these problems would be, because they were unaddressed, would carry on. That's only in health. You know, but if you look at the whole of the economy, again, it's about a fifth. The GDP fell by about a fifth. We paid, you know, 70 billion in furlough payments at the same time as we were reducing our output. And that means inflation, you know, because if you give people more money to spend and make less stuff, then all that happens is that money chases that reduced amount of stuff. And now we've all got inflation. It's like cost of living crisis. Where did that come from? Well, it came from the furlough payments.
It was certainly a significant point. Obviously, somebody could say, well, no, it's Vladimir Putin invading Ukraine, or it's the fact that central governments have been printing lots of money for 10 years.
There's a whole lot of factors, but
those are two factors.
The lockdown and the money injection did play a role.
Absolutely.
But it's mainly, of course, not turned up in people's wages. It's turned up in the margins that manufacturers are charging, because they were basically seeing goods were just flying out of the warehouse, so they could put up the markup without worrying about running out of customers. So that's where a lot of the inflation came from. But there's also supply chain disruptions, which COVID caused. We're running out of energy. There's a whole lot of factors there. But I want to come back to the point that if you don't plan for something, if you don't practice it, you can't do it. That's one of the main insights the military has, which is why they play war games all the time. We knew 100% certain there was going to be a pandemic at some point. The further we got away from the Spanish flu, the larger the population of humanity, the further we press into ecological areas, the more likely it is to happen. This is the sort of thing we should be doing drills from. We would have known what to do. Instead, nobody from Boris Johnson down knew what to do. We had chaos, and that's what's turning up in the statistics.
OK, let me bring up some of the statistics for the pandemic from different countries. We've got a set of statistics here that show the number of deaths relative to an average number of deaths. Obviously, from a statistical perspective, you can say that a country the size of the UK, 65 million people, will experience X number of people dying week on week. And then you can look at the pandemic and you can say this many more people died over the average, or this many fewer people died relative to the average. And if you look at those numbers, Peru is off the charts, Russia is off the charts, South Africa is very high. If you run down the list, the UK is middle-ish average ranking. Global average is 96. But then we start getting something interesting. Sweden is very low relative to other developed nations. China, Japan and Australia all suffer a fall in the numbers. In Australia, it's quite large. It's, I believe, 28 fewer deaths per 100,000 people during the course of the COVID pandemic. I have no idea what Australians were dying of when they were leaving their houses otherwise. But you've already said you're not in favour of herd immunity. That was the strategy Sweden adopted. They're at the bottom of the table.
I've experienced 4 countries for the COVID. Okay, I was in Australia when it started, in the Netherlands and in Thailand, and of course I'm based in the UK as well. And the patterns were quite radically different. The UK and the Netherlands went for herd immunity, which is why I left those countries and moved to Thailand. Thailand and Australia both practiced exclusion and isolation.
Very heavy lockdowns in Australia.
But in the Thai case, that's what I really did quite live through. Every morning we could go to a local market and buy 4 masks for the princely sum, 4 masks total of 50p. Okay, that's how many masks they were manufacturing. Everywhere you went, people wore masks internally. There was a very effective isolation process, and within, as I said, 6 to 8 weeks of us arriving, there were no domestic cases in Thailand, and that lasted until December, from May, June to December. So it was possible to do it effectively, and believe me, Thais are very social people. Okay, but they accepted the public health rules.
Let me bring in Michelle here. Michelle, when we're looking at these numbers from around the world, obviously there are going to be factors here. How good is the healthcare service in a particular country? How good are the support services in a particular country? But if we're looking at West European and North American countries, so there is a reasonable level of comparison between them. Sweden did very much better than France and Britain, who took a relatively strict course, and did very much better than a lot of countries that had extremely strict lockdown protocols. So what do people in your field make of that?
So me personally, I would say, is it down to, and the article discussed earlier talked about this too, whether you needed mandatory policies or whether voluntary behavior change would have been sufficient. So I wonder if what we're comparing isn't that was social distancing important in preventing the spread? Yes, of course, some degree of that is important. Now, whether that needs to be enforced or it can happen in some societies on a voluntary basis, that is perhaps also what we see. So if we think about in terms of the sort of the social protection mechanisms in play and how different they are across, say, North America and say Sweden. So I think those factors also impact how much people are able to follow guidance, even if it's not mandatory, around staying at home, taking time off work, if they're feeling unwell. If you're a daily wage earner and you don't have access to free healthcare, that's a really, really difficult choice to make, and there's an incentive to get back even if you're unwell. So it's these sorts of factors that also would make a difference, I would say.
James, I think one of the big problems that I certainly have with various different government responses to COVID, regardless of which route they took, is there seemed to be a clampdown on any dissent and anyone saying, well, hang on a second, how about this policy here or how about that policy there? What did you make of that? Did you think that that was a reasonable way for people to go? Because somebody has to lead and somebody has to follow. And if a government decides on a course of action, China was incredibly strict. There were a lot of protests from people inside their buildings, for instance, switching on lights and playing horns. What did you make of that?
I think there was a mad authoritarian streak at large in Britain. And I'm surprised that we talk about herd immunity. Britain had more days in lockdown than almost every other European country. I think Ireland was compatible. So it was it's pointedly authoritarian response. My nephew was imprisoned in the Manchester student accommodations. It was a very strange time. Both my daughters I hesitate to say, got in trouble with the police because they were out playing in parks, which was the only place to socialise. It was extraordinarily authoritarian approach. And I can remember taking part in a protest against the lockdown, and the police suppressed the protest on the basis that we were spreading the virus, which I can understand.
And then they allowed all the racial protest, racial injustice protest marches, which happened as well. Those were all permitted to run ahead.
This partly comes back to the comment I made earlier about if you don't practice something, you can't do it properly. And Thailand, whole of Asia, had the experience of the first SARS outbreak back in the early 2000s. Everybody in Thailand had masks. Everybody was used to wearing them. It's a habit in most of Asia. It's much more uncomfortable to wear a mask in Asia than it is here because the air's already hot in Asia. It's quite cool over here. That irritating thing about masks is why people take them off. It worked in Thailand. It didn't work in the UK.
Gentlemen, thank you very much for joining me today to talk about this subject. I'm afraid to say that is all that we have time for right now. Remember, you can find more discussion and debate, though, if you head on over to our YouTube channel. Just go to YouTube, search for Roundtable TRT World. But for now, from me here and the entire team, thank you for watching and goodbye.